Atrium Health is in the final stages of launching a community doula program for Black mothers. The statistics remain grim.
The Black women are 2 to 3 times more likely to suffer pregnancy-related deaths. As Queen City News anchor Ann White-Little explains tonight, there's now a pilot program to help reverse the disturbing trends.
I'm a sweet boy.
Alicia Fuller welcomed John Joel to the world December 30th.
Every child is different. Every birth is different. Every labor is different. So I labored with him for 31 hours.
Her family of 6 is complete. Fuller and her husband own a catering business, but being a mom is her most rewarding job.
It's a blessing to me to be charged with being a mother. And have these little personalities and these little people that you look after.
Navigating pregnancy got a little easier after hiring a doula to help with her 3rd and 4th babies.
Hey, baby.
A doula is a trained professional who provides guidance and support to pregnant women before, during, and after childbirth.
It makes all the difference. I mean, just in your confidence and knowing that you feel like somebody's going to be in your corner and they can advocate for you, even if you can't speak for yourself.
Because of her experiences, Fuller's doctor invited her to serve on the advisory board for the RISE Atrium Community Doula Program. RISE stands for Reducing Inequities, Supporting Empowerment. The goal is to offer doula support free of charge for Black female patients.
I'm so grateful to be here.
Raquel Washington is a doula and the program coordinator.
My biggest hope is that folks have empowering birth experiences, and those are transformational. Of course, we want to improve outcomes and make sure that mothers and babies are able to go home together and thrive.
In North Carolina, according to the state, Black babies are 2.5 times more likely to die than white babies, and Black women experience almost twice the rate of maternal mortality than white women.
When we consider, like you said, how far we've come with science and technology and all of those things, what it really comes down to is a lot of these deaths are in fact preventable. There is something that can be done.
I'm going to speak as much as I can speak, and whoever I can speak to about it, whoever I can help about it, who I can advocate for, I'm going to do that.
The pilot program is paid for thanks to an $800,000 grant from Truist. They hope to hire 10 doulas to support 100 patients before, during, and after birth.
We're definitely looking forward to helping more people that look like me that are unable to afford the cost.
Fuller feels seen.
I love you.
And heard. She wants to help other mothers make memories and be there for their babies.
It's so worth it. It is the most rewarding, most crazy, most strenuous, most tiring job in the world, but I would not trade it for anything. God bless you. God bless you.
In Charlotte, Ann White-Little, Queen City News.
Just beautiful. The doula program will help Black patients at the North Park and Myers Park OB practices. It's a community-based care model, so managers are now looking for local doulas to join the program they believe will enhance the birth experience for Black families.